This video is on headache. We will examine the red flags of headache and then the common causes that you may see. So let's start with red flags. This is so important to know. They can be remembered by the acronym VIVID: vascular infective, vision threatening, raised intracranial pressure, and dissection. Vascular causes include subarachnoid hemorrhage, indicated by thunderclap headache. So the patient may say it came on so suddenly and was so severe and the worst thing ever. Hematomas are indicated by trauma. If the patient has factors in accordance with Virchow's triad, they may have cerebral venous sinus thrombosis. Infective causes include meningitis and encephalitis, and these are flagged by neck stiffness, phonophobia, so sensitive to sound, and photophobia, sensitive to light. Vision-threatening causes include temporal arteritis, or GCA, giant cell arteritis, and this is characterized by diplopia, as well as scalp and jaw pain, so the patient may describe it being painful to brush their hair. Acute glaucoma is implied by eye pain and diplopia, especially in the elderly population. Raised intracranial pressure are commonly caused by space-occupying lesions such as tumors, abscesses, or hydrocephalus. Signs and symptoms include vomiting, papilledema, retinal hemorrhages, and an abducens nerve palsy. Finally, carotid dissection is essential to exclude, typified by facial and neck pain. Now let's look at less concerning but more common causes of headache. Tension-type headache is the most common headache and is described as a tight, band-like pain and can be associated with hypertension. Migraine should be a diagnosis of exclusion, so it's not anything else. But it is associated with an aura, as well as photophobia, phonophobia, and nausea and vomiting. Sinusitis causes congestion, rhinorrhea or runny nose, and facial pain over the sinuses and is associated with infections. Also, cluster headaches are extremely painful around the eye and has other eye symptoms such as ptosis. It is often also one-sided, and you would be suspicious of medication overuse if the patient has been taking a lot of painkillers, ironically for their headaches. TMJ syndrome is something to keep in mind and is suggested if the patient has jaw stiffness, as well as tinnitus and vertigo. And this image shows the pattern of pain associated with some of the common causes. Thank you for watching. If you learned something, please tell a friend who may also find it useful, and follow us on Instagram at MidnightMed1200.